Hi class, today we're going to talk about how to determine the estimated due date of a patient when they have normal regular periods. You can only use this method if they have regular periods. If not, we'll have to do ultrasound dating to estimate the due date. There are different ways that you're going to see estimated due date or the due date of the client. Sometimes you'll see it written as EDD or estimated due date. Sometimes you'll see EDC or estimated date of confinement. That's referring to confinement of the pregnant person and the fetus. It's kind of a rude word, so we don't really use it anymore because pregnant women are healthy, right? And so we don't usually use that word that term anymore, but you may see it. And then you also may see EDB, estimated date of birth. All of those things are referring to the due date of the pregnancy. When we estimate based off the last menstrual period, remember from our repro lecture that the last menstrual period is the first day of bleed. Most women will know when their last menstrual period was, and so that we can usually calculate it off of that if they have regular cycles. We also need to know that pregnancies last 40 weeks from the last menstrual period. So again, like we learned in our repro lecture, women don't ovulate until usually about 2 weeks after the last menstrual period started. And so typically, we're not pregnant for those first 2 weeks of the 40 weeks. However, most pregnancies last 40 weeks, and so that's how we're getting this estimated due date. Another thing we need to know is how many days there are in each month to get this calculation. So I don't know if you remember the little rhyme, 30 days has September, April, June, and November. All the rest are 31 except for February has 28 days. So when we use this, we don't mess with leap year. We're just going to use 28 days for February. So if you remember, September, April, June, and November have 30 days. All the rest have 31, and then February has 28 days. That will help you in getting your estimated due date. We use Nagel's rule to get the estimated due date. That's the person that came up with this rule. And we're going to take the last menstrual period, and if that last menstrual period fell within April through December months, we're going to subtract 3 months from that last menstrual period. We're going to add 7 days, and then we're going to add 1 year, and that will give us our due date. 40 weeks is technically 9 months, right? And there are 12 months in the year. So if the last menstrual period fell in January, February, or March, there's no need to add that 1 year because it's going to fall within the same year. So in that case, January, February, or March, we're going to subtract 3 months and add 7 days only. We'll do some examples. Let's say a woman is stating her last menstrual period was April 15th. Of 2024. So we're gonna we're in the April through December month, so we need to subtract 3 months, add 7 days, and add 1 year to get our due date. April's month is the number 4, right? It's the 4th month, so you could write it out in number format: 4/15, 24. We can subtract our 3 months. 4 minus 3 is 1, which is January, right? Add 7 days to 15. 15 plus 7 is 22. And then add a year, 2025. So our estimated due date for this last menstrual period would be January 22nd, 2025. Here. Okay, let's do another one. We'll do one in January. So she's saying her last menstrual period was January 7th, 2025. So 1/7/25. So we're going to subtract 3 months. January, we're going to have to do this by the months instead of the numbers, right? So January, December, November, October. October is the 10th month. Add 7 days. And we don't need to add a year because it's in the beginning of the year, right? So it'll fall in that same month or same year. So this estimated due date would be October 14th, 2025. Do another one. Let's say, July. Let's say 4th. We'll say 25. So what would her estimated due date be? The July is the 7th month, so we'd subtract 3 from that, which puts us at April, right? 4th plus 7 is 11, and then add a year, 2026. So her estimated due date would be April 11th, 2026 there. All right, let's do one toward the end of the month. Let's do August. How about 28th, 2024. All right, so August is our 8th month, which puts us at May. We need to add 7 days, but that's going to push us into a different month, I think. So we'll start with 28 plus 7 is, oh gosh, guys. 35. And in May, there are only 31 days, right? So we'll have 6 days left, or 4 days left over to add. So it's going to push us into June, right? We're going to pass that 31 days. So we have 4 days left, right? Which means it's going to be June 4th. Add a year. Oops, add 1 year. 2025. That makes sense? We'll practice some more hard ones in class. So June 4th, 2025 for that estimated due date. Do another one. Let's say their last menstrual period was February. February, let's say 20th, 2023. Let's give it a different year. So February falls in those first 3 months, so it's going to be in the same year. Not going to change there. February is at the beginning of the year as well, so we're going to push into that the other months, so our numbers aren't going to work, right? So we're going to go on our hand, we're going to go January, January, December, November. And then add 7 days, 27th. And we don't need to add the year because we're in the beginning of the month. We're going to birth in the same year. So November 27th, 2023 is the estimated due date there. There are some practice, Nagel's rule, finding an estimated due date listed in Canvas, and then you can also use Quizlet to practice different due dates too. You can also do this backwards if you guys want to challenge yourselves. Maybe go with your birthday and work backwards. Add 3 months, subtract 7 days, and then subtract a year, and you can find out perhaps an estimated last menstrual period for your mother. Yeah, so keep practicing. Those are going to come up pretty frequently in quizzes, HESI, and in NCLEX. If you have questions, please write it down and bring it to class, or you can email me too. Hope you guys have a great day.